Okay, thank you. How about, will it affect my eye? Means if I blow it on the esophagus?
Eventually, it will come to that because cells communicate.
Because I have a lens, a cataract lens on
Indirectly.
my,
Yeah, but you don't have to blow it directly.
directly. Okay.
Don't blow it
So,
directly.
okay, so it's safe to blow from the esophagus
On
down.
other areas, yes.
Thank you very much, Doctora. I learned a lot.
Yeah, you're
Thank you,
welcome.
Mary. Thank you, Doctora. So, just to let everyone know that we can probably extend 15 to 20 more minutes because I've just asked Doctora to just be with us for 1 hour. So, is it okay with you, Doctora, if we can extend for at least 15 to 20
Sure.
more minutes? Okay, thank you
Sure.
so much. So let me just give other people a chance to ask right now. So we have here Wendy.
Hi, good evening. Hello, good day.
Yeah.
Doctor, thank you so
Yeah.
much for your time. I have a question regarding autism. My daughter, she's an adult and she loves the blower. I just wondered, do you have anything specific? She really loves all around her head area, in particular in the vagus nerve, all around the neck. Her feet are too hypersensitive, although I feel that that would be very beneficial for her. But anything that you could suggest, I would greatly appreciate. Thank you.
I have a friend who bought an ITeraCare device, and she has an autistic kid. He's about 18 years old. And ever since she had been blowing it on him, she found out that some of his cognitive abilities have improved. And she has been using it for only about a month by this time. So that is
Yes.
my experience.
Okay. Well, thank you. Yes, I definitely experienced that. I just wondered if there were particular areas of what you noticed worked best with in your experience or in your practice or anything. Can I ask you something else then regarding kidney cancer? And so I have a family member that has is also using it, and she doesn't hydrate as well. She does her best, but she does use the blower a lot. I feel perhaps too much is and not hydrating enough. It may be too much on the body. I'm not sure. She seems to be well, although I feel like it's a lot of energy going through her. So she's definitely tired, and I feel even emotionally it's a lot on her psyche, but she doesn't have other practices to really help her. She's learning. She's an elder. She's my mother. So, 85, but she has a cyst on one kidney and a tumor on the other, and good spirits. And we're hoping to go back and have a test and see that, there's a different information now.
You just
Anything
have
to share?
that the literature tells us that when you use our device, your exposure time should only be 2 hours. I don't really know about a particular reason about it because in my case, when I do the blowing, I enjoy it. No, I feel loved. I feel the warmth. So I tend to overtime my sessions because they make me feel good. So far, the effects that I have been positive. But it is, if you can limit to 2 hours exposure in a day, and you can do it on another day.
Okay, thank you. Yeah, she's definitely not doing up to 2 hours, but I just thought maybe more water would be better. That was my concern.
It's also important. You have to drink
Okay.
water. You have to drink water before the session, and then another session after the session.
And that's enough if they don't drink ITera water throughout the day and just drink regular water, or not even enough.
Yeah,
it's okay.
Yeah, of course, it's okay.
Right.
It's okay.
All right. Well, thank you so much. I appreciate it.
Mm-hmm.
Okay, thank you. Wendy, let's go to Rhino. Hi, Rhino.
Oh, hello. Can you hear me?
Yeah, we can
Yes,
hear
right
you.
now.
Okay. Hi. I have a question. I have, it's called a hammer toe. I'm wondering, I don't have one yet, but if I blow it, will that toe straighten? Can it do that?
Theoretically, it should straighten eventually, but you just
Oh,
have to be
really?
patient with it.
Okay. Well, thank you very much.
Yeah.
Thank you.
Mhm.
Okay, so you're welcome. Okay, so now, yeah, there are questions that are in the chat room. So would you want me to just read it for you, Doki?
Okay,
Doctora,
please.
and then okay, so I'm wondering if Sonraya is also raising her hand, or do you still
I
have
am.
a question? Okay, let's go to Sonraya and then Barbara, and then I'm gonna read from the chat room.
Thank you. Just two quick questions. One, for the spine, since it penetrates, 12 inches, can't we use the front of the body up and down to blow our spine?
Yes, we can use it to blow. Yeah.
Okay, good. And then my last question is, it states on there that it really works with water retention. And I've been using it for about a month and I haven't noticed a change. So I'm wondering, I noticed there was one protocol that I watched on YouTube where he had different protocols for different things, where you would blow your kidneys or this or that. Is there some particular part of my body that I would be blowing to assist the water retention?
In my experience with regards to water retention, water retention can be found in all organs, in all tissues. Um, this is a personal experience. I had been blowing the ITeraCare device in myself, and I found out that my legs, the water has gone down to my legs, maybe pulled by gravity. So all the water retention has from my upper parts of the body have disappeared, but it has gone down to my legs. And so I felt a tightening on my legs and on the dorsum of my foot. So what I did, I just blowed on those areas. And immediately, to my surprise, the edema over a 15-minute session has diminished by 25%. And then you blow it on the next day, and then the day after, the edema gets diminishing. But it does not work like today, the edema will go, and then the next day, it will come back. I think it's cumulative. Whatever you have lost in the blowing the previous day, it does not come back, and you will have to work on what remains. That is my personal experience. So we have different responses depending on the health condition of our body.
Okay, thank you so much.
Yes.
Thank you. Okay, now let's go to Barbara.
Okay. Yes, thank you so much for all this information. I have a question concerning this device, which I'm using it now, and I really love it. But I'm wondering about people who suffer from any form of mental illness, how this might be able to help them.
It will help them a great deal. The frequency of the ITeraCare device has the calming effect. And once the mind is calmed down, it is available. It is open to frequencies that are delivered to the brain. the normal frequencies that we have in our ITeraCare device. So you just have to continue on using it.
Uh-huh. So would you use it in all of the areas where the chakra, you put it on those points, and also as well as on the crown of the head, where would be area that you would want to really concentrate for someone who suffers from bipolar or schizophrenia?
I think you will just have to blow it all over, and if one is hypertensive, just avoid the crown.
Right. Okay. All right. And then one last question concerning the water. There are instructions that say when you're using the device prior to using it, you should have 2 cups of warm water. Sometimes that can be a challenge. Do you always have to have the water warm? Or, I mean, I'm drinking it at room temperature, but there have been times that I've warmed it. So is that really important to always have it when you're doing the treatment warmed?
My personal experience, I don't always drink the warm water.
Uh-huh.
Sometimes I don't even drink water at all, especially when you are so tired and you forget to drink. But drinking water will do a lot of good because it will hydrate the cells, and especially if it is charged water.
Right.
Yeah, that's
Right.
right.
Okay. Thank you.
Much for those questions. Now, I'm just browsing through all the questions that are in the chat room, and I'm just gonna read more on those that particularly like Doctora can particularly answer. Like there's a question here about breast cancer. I said from Evelyn, it's if the patient has breast cancer and was operated for more than a year now, but due to dye that was injected, there was a cyst formation. Can I blow on the area? It's near the operated area, but the operation is like a year already.
Yes, you can safely blow over the area.
Okay, thank you. There's another question. Is it applicable for hyperthyroid?
My sister had hyperthyroidism, and she was even scheduled for surgery because her attending doctor was afraid that she might get a thyroid crisis. So when I learned about her surgery, I told her to defer, to cancel the surgery, and let's find out if this ITeraCare device will work. And so far, it's been a month now. The mass on my sister's neck has reduced to 50%, and the hard mass has become softer, and there is no pain. And she's walking around as healthy as anyone. So yes, you can use it for hyperthyroidism.
Wow, that's really great to know. There's a question here about Alzheimer's. She also has Alzheimer's. Where can I blow on her?
If she does not have implants on the eyes, you can blow it on the face. You can focus on the face, but do not neglect also the other parts of the body, because the different parts of the body, they work together synchronously. The systems in the body, they work together. So you have to blow all over, and maybe just focus more on the face.
Okay, thank you, Doctora. For the paralyzed hand due to stroke, where to blow? And also for diabetic patients.
You can blow on the particularly focus on the spinal column, and then blow on the soles of the feet and the hands.
Okay, so
Spine, soles, feet, and hands.
I have a nephew who underwent major brain surgery for 3 years. He stayed 8 months in the hospital in Florida from comatose condition because he fell from a very high stairs. She now is walking with the help of the cane and very weak left side of the body. can we blow in his brain? This is from TC.
The only contraindication for blowing on the head is hypertension, as far as the literature on the device is concerned. So you can blow all over.
Okay, thank you. Yeah. So what about for anxiety?
Yeah, that's a good one. When in the university that I work with, it's you always get this high strong feeling. So I know I get anxiety, panic attack sometimes. So I just get my device from my office table drawer and blow it on my face, and then I calm down.
Wow.
The perspective changes into something that is favorable.
Wow. So that's really great to know. So right now we're about to end, and I'm seeing hands here now. It's I'll go first with Renee.
Yes. Hi.
Hi,
I'm listening to a lot of
Renee.
the questions with some of the cautionary answers. For instance, with breast implants, you don't want to blow there, and then if you had some sort of metal and you don't want to blow there. As an acupuncturist or massage therapist, does this mean that one should ask every patient, for every woman, do you have breast implants before blowing on their back, for instance? Or do you have to ask, do you have any metal rods? And same thing, can you blow on the teeth to help the teeth? But if you have mercury fillings, what is your thoughts in regards to all of this?
When you have a medical or a paramedical practice, it is very important to get the patient's history, the medical history. So you will find out what if they got implants on their body and all the other things that you need to know about the patient.
So if they come in with back pain and it's right behind the breast, and you say, well, I can't really work on that.
So just make sure they do not have implants and you can blow on the affected areas.
Okay.
They usually get better, they feel better. It's usually the pain that they come in for help. And when you can reduce that, you can diminish that, then it's good to go. You can healing starts from there.
Okay. And for the teeth, I mean, you would think it would help the teeth, but is it okay with the mercury fillings?
I use ITeraCare for my teeth. In fact, I was scheduled to go to my dentist for a visit for ever since I got the device. But when I started blowing on my teeth, I felt that my teeth have become stronger, and the swollenness of some sorts has diminished. So until now, I haven't still gotten to my dentist because I really haven't felt the need for it yet. I think the ITeraCare device is doing its job. It's strengthening my teeth and it's strengthening my gums.
And so it's no concern that there's fillings, whether they're mercury or the other resin. So that doesn't matter.
It doesn't really matter. It's just on the tooth.
Excellent. Excellent. Yeah. Thank you very much.
Okay, thank you. And then now let's go for Shari.
Yes, can you hear me?
Yes, Sherry.
This is actually Richard and Sherry. What about parasites?
Does it kill parasites?
Does it kill parasites?
It is supposed to kill parasites. When parasites get into the body, they are aliens in the body. And they will, the frequency of the device will immediately determine that they are aliens. So these parasites will get to vibrate at an abnormal frequency until they are blown off.
Oh, thank you. That's awesome.
Yeah.
We really enjoy it.
Yes.
Okay, so thank you, Sherry. So right now, just a recap. Thank you, Dr. Just a recap for some of the questions that has been asking here. Somebody asked about the water. Can we charge the water? How many seconds do you charge the water? So when you do charge the water, you can charge a glass of water around 15 to 30 seconds, and then you drink it. But if you charge the water using the frequency of ITeraCare, like a pitcher of water, you can actually do that for 1 minute to 2 minutes, and that can actually last for the next 16 hours, 16 to 18 hours. So provided you don't put that back in the fridge. So the frequency that charged water, when exposed with radiation, it can actually diminish the energy that it has actually received from the device. So it's better off that when you charge the water, then you drink it right away. But for particular questions like how long would it last, it can actually last up to 16 hours. So, and then anything that has to do with implants, as I have repeatedly hear it from Doctora and from the literature and the discussions from other experts, anything that had an implants in the body, we particularly try to avoid that. I think because of the fact that this device emits not just frequency, but also heat. And when you talk about the heat that it emits, metals can actually absorb heat. And we do not want that the heat that is being released by the device would actually be absorbed by that particular metal. So that's particularly why it's, you know, the way I look at it, I read and I continually listen from experts. One of the major reason is that metals do attract heat, absorb heat. But for small metal implants, like in the teeth or in the teeth area, so I think that would not be doing much because of the quantity of the metal that is being implanted. It cannot hold that much energy or much heat. Okay, so I think if there are no more questions, this is really an amazing time. Dr. Seguerra, we are really appreciating all the inputs and the sharing, and we look forward for having more of this. We've talked to the leaders, like Sister Gloria is here, Sister Faith, Brother Nathan, and on all the rest of the leaders that are here. We've talked about having this kind of a session at least twice a month. So we would be inviting other doctors from other fields to also be part of this wonderful discussion that we have started right now. So that's it. So thank you so much for this wonderful time that we all have.